in many ways, it also within the women's movement itself, the differences between different countries, different regions, that also had to be worked out as well. So we're not just talking about women's advocacy groups in a sort of neutral context, we're talking about very different types of women's groups that had to work together. And we're also talking about very different types of bureaucrats. Not everybody was working in UNFPA who was behind the scenes trying to do it, and there was a lot of convincing that had to be done. And I absolutely agree with Marie Simonen. It really set the agenda for the population and development policy. It did bring women's rights in, it did bring gender equality in, and it certainly brought in once very taboo topics of sexuality, sexual health on the table. This is what you were talking about, the moving of private to public. So a huge gain, and I agree it came along with a sense of a lot more autonomy for women, the sense of empowerment, and really trying to talk about cultural differences. So for me, that was a huge success of Cairo. Now let me turn to what I see as a bit more disappointing. So I think it was problematic in the sense that it dared to put onto the agenda things that were very hard to then hold on the agenda. I mean, it was a particular moment in time, and I would say the last 15 years has been about trying to hold some of those issues. You heard Marie very cleverly, and the language used was very subtle, the way she was talking about, well, okay, this is how, she mentioned the word abortion once, this is how we could get it on the table, but it's being put into certain terms. And I think was something that was daring and is there, but it's still a difficult one. And I know in the Netherlands it is as well, everywhere. And then it didn't really address other issues as well. I mean, it's something that I'm going to come up to some of the other issues I felt that could have been addressed. So it was a gain, but it was also something that hid some things as well. And then I also think that we have to remember it's not a legally binding convention. So it wasn't as successful as one would like to say. The document is good, but then actually the follow-up is partly problematic because there's not a legal binding convention there, but also there was not the money provided. And I guess that's where I would like to talk a little bit about that. Because I think that although it was very important to put gender, women's rights into the center, there was a problem of, pushing a human rights democratic framework. It did put to one side the economic framework. And I think that is very problematic and something we have to remember now as we're going into an economic crisis. And I think that some of those difficult discussions that were about economics and politics and social issues were things that now we're seeing the price because they weren't talked about in Cairo. I know that's something that I've put on the table we can talk about, but I think it's an important one to talk about right now as we are pushing so hard to talk about economic and financial issues. We might find that democracy, gender, and human rights language gets challenged again. So I'm not saying I have a good answer to that, but I'm just aware that Cairo didn't put the economics language and didn't manage to get the money for it either. If we could move to the next slide. Okay, then this is really where I think there were some other hitches. I'm using that word lightly, but it's still a very important one. And I think we heard in Marie Simonen that these are things that are being dealt with in the ways that one can as a bureaucracy, as a government. But how do you really get those sorts of changes happening on the ground? How do you really get the medical establishment talking about the choices of women? How do you bring out self-esteem and knowledge? Now we heard about one project which was rewarding young Ethiopian women with goats. That's one interesting way of doing it, but there is a much more deeper thing about how do you talk about your own body, how do you talk about choice within the different cultures that you have. And at the same time, what are the types of appropriate technologies which will allow women at different life stages to talk about those choices. I mean, these are very big issues, but I think that Cairo and the whole agenda does have to deal with them. Because essentially what is really appropriate and what is really acceptable for different women in different contexts. And I'm still very aware, although I know it's important to do it in an international context, that we still put people in numbers and we still talk about, it's a demographic approach to very sensitive issues. But I think it hides, again, the difficulty of talking to those young Liberian women about what is fistula, why did that happen, how can they changes. I mean, all of these things take a lot of time, and 15 years is actually a very short time when you're talking about those sorts of changes. So it's not a criticism of Cairo, it's just saying we're dealing with extremely complex, difficult issues, and unfortunately there isn't going to be one blueprint, as well as it was argued in Cairo, that's going to help everybody. Okay, so next slide. So I guess I'm going to be now going on to a bit more of a controversial topic, I guess, because for me, I think that I would say that for all the good that Cairo was, and I would say still is, the real problem was that there were important systemic inequalities in the health systems, which Cairo couldn't help to deal with. But those are the issues that need to be looked at. And that's not just about seeing health systems separately, but they're within a global economic order that essentially was just not concurrent with the Cairo agenda. Now, I know, and I know some of the people in the room might want to tell me to be more nuanced or not be critical of neoliberalism or market-oriented approaches, but essentially I think when you're talking about delivery of reproductive and sexual health and rights, I haven't got that in there, for the vast majority of people, it just couldn't work given the way we have focused on very different types of issues as development issues, the development issues of trade and economics essentially. So that the issues that Cairo was having to do, which was health, we're not going to get the money, but neither was it going to be seen as crucial and as central to the development agenda. Marie Simonen has done a very good job of trying to show how it could be, but I don't think, and you could see by that last graph, people weren't listening to that. I mean, there was less money for family planning, less money for reproductive health, and we were going, HIV and AIDS, for reasons which I'd like to come into, were going up. So, unfortunately, the priorities of Cairo were not the priority of the overall development agenda. So, next issue. I'm just going to mention a few people that sort of to back up that. But Rosalind Paczewski, who is a well-known sexual rights and reproductive health activist, she's written a lot herself. She just points out that, and this is a quote from her, that there are a lot of issues around enabling women to have choices. And if I could just go on to the next quote. From Mohan Rao, who's a doctor in India, also is underlining that reproductive rights are linked into economic contexts, which this neoliberal agenda has not allowed. Okay, could we move on? Okay, so let me get to my next point, which is, again, I was trying hard to be provocative, about the Millennium Development Goals. I totally agree that maternal mortality, child mortality is a crucial issue. My concern was that the Millennium Development Goals put those things up the forefront and as a result lost the reproductive rights and sexual rights agenda. It lost it for many complicated reasons, political as much as anything else, but I think that was a loss to the Cairo agenda. And I think it disengaged from what I would call, and I'm using the word feminist very determinedly, lens of reproductive rights and health, so that it shifted away, and in a sense you could hear that with Marie Simonen's talk, it shifted away from sexual and reproductive rights into health issues and ensuring women's well-being and health. It's a very subtle shift, but it means that you're talking about, let's say, women as in that sort of, I would say, objectifying way almost, although it's not intended in that way, but inevitably you get that women are the poorest of the poor, they need help, they're sort of the people that need to get these sorts of things to them. We can deliver it. There's a technical service. There are these three things we know that work. We're not actually talking about working with them in the different cultural contexts to understand what is their well-being, what is their choice, how do you actually deal with it. There are very good reasons for not being able to do that because, as I said, it takes a lot of time. It's not just going to be a one-off project that will deliver it or a one-off document. But unfortunately, the Millennium Development Goals, Cairo was a negotiated document. Millennium Development Goals was far less so. It's 8 goals with 48 indicators. a little bit later on, reproductive rights or sort of health, sorry, was added in. But essentially, you've got a very different kind of approach to development already from Cairo with the MDGs. And I think that the focus on maternal mortality, although it's very crucial,